What's up, Kosova? This is Coach Q. I'm your host for the upcoming podcast called Never the Right Time. We are on every Tuesdays, 11:30 a.m. to 12:30 p.m. 103.5, 105.5 Urban FM. We're going to be talking all things around health, fitness, lifestyle. Please check us out. Here's a quick shout out to our sponsors, 5-Star Fitness and Onze Recovery. 5-Star Fitness. Goes without saying, we need to be active nowadays. It's a must. And to help with this, 5-Star Fitness, with locations across the country, has established itself as the place to pursue your fitness goals. Now, Onze Recovery, let's talk about stress from daily life, leaving us depleted, in need of that reboot. Onze Recovery offers different types of therapies to help you recover from the daily stresses, especially when we are limited with time. Hey Kosova, what's up? This is Coach Q, and we're back with another episode of Never the Right Time on Urban FM, 103.5, 105.5 FM. A big shout out to our sponsors for making this happen. We have 5-Star Fit, as well as Onze Recovery and Menda Salon, the preferred salon in Pristina. Today, I get to sit down and thank you for your time, Adea. Adea Karakashi. It's so tempting, sorry, to not pronounce it in a Japanese way. But again, Adea is actually my dentist. And wanted to sit down with her to talk about different dental/oral health topics. So before we dive into that, Adea, maybe you could give a bit of an introduction of who you are, what you do, where you do it at.
Yes, of course. As Q said, I'm Adea Karakashi, Q's dentist.
There's other patients too.
Yeah, other patients too. Q's my favorite, of course, since I'm sitting with him in his podcast.
Okay.
So I'm a dentist living in Pristina. I work at a private clinic called Identity Dental Clinic with Dr. Vjosa Hamiti.
Shout out Vjosa.
Yes. And I'm also doing my PhD in University of Zagreb, Croatia. And yeah, I'm working as a dentist. I prefer aesthetic dentist and also oral health. I'm an advocate to oral health and also healthy living in general and well-being. So yeah.
So I guess this is one question I ask a lot of my guests is, how did you decide to become a dentist?
I thought you were going to say, I ask this question to all my dentists, but I forgot that. I guess I'm the only one in Kosovo,
yeah. Well, yes. Well, Vjosa has, I think checked and cleaned my teeth on occasion. Yeah.
Yeah.
I love it. The whole country knows about my dental history in Kosovo, so yeah.
You are really strict. Just as you are at the gym, I guess you are at the clinic too. So dental checkups every 3 months. Best patient I ever had.
Oh, I appreciate it. Thank you.
And
and that's, I think we'll probably touch upon this a bit later on.
Yeah.
But in terms of it's like these small things can lead to bigger things, right? Whether it's like a small cavity becomes a big cavity, that kind of thing. So I do try to make it a point to have timely checkups.
Yeah, you do.
So,
and going back to your question, because
yes.
I deviated a little. Since I was little, I guess, I was amazed by human body and the things that the human body can do and the healing process by itself, especially. And also, I guess I'm the kind of girl or woman now that I always wanted to help others. So it was like something that just clicked with me, like medicine, study the human body, and also being able to help others. So that's how I decided that definitely it had something to do with medicine. And then I just went to like a dental university, and that's how everything started.
Was there anything like particular? Because, for example, I think, I'll speak for myself, because like the first time I think I went to a dentist probably wasn't a pleasant one.
I know.
Right. And I think a lot of people, unfortunately, like,
Hate us, I know.
you're in the well. I think it's probably goes across the board for most doctors, right?
Yeah.
Like you're there because
Yeah, it's not
maybe there's
fun.
already a problem,
Yeah,
right? And
yeah.
even
And
if it's
usually in Kosovo, it's a huge problem when they come,
okay,
because they come at the end to treat the process that they had, or the inflammation or infection. They wait until it's something huge or something big, and then they come. It's never like just a routine checkup and, oh, everything's fine, just go now, bye.
okay,
So that's the reason why everyone hates us, because they usually come to do something that's big,
yeah.
not like just a checkup and cleaning and scaling.
So when you say big, what kind of like examples? What would be common? Is it like root canal big, or like like
Pain, usually
so
pain.
the pain is too
Yeah,
much.
the
It's
pain is
unbearable.
too
yeah?
much. It's
Yeah.
unbearable. They say that they take antibiotics by itself, like painkillers, and no, nothing's working. So I came at you because, I'm afraid of dentists, and this was the last thing that I had to do in order to stop the pain.
Yeah.
And it's usually like a huge infection that you need to treat with several antibiotics, and then do a root canal and draining and all those kind of stuff. So it's never easy for the patient and also for us,
Sure.
because it's usually the end and you have to take the tooth out, or
So it becomes a proper procedure, like an operation almost.
yeah, and sometimes it ends up with an operation. So it's not a good thing to have like your first dental checkup and it has to be it has to be that, like
Yeah.
a surgical thing,
Yeah.
because your first impression, it should be good. Like your first meeting with a
Sure.
dentist, it should be easy. Like only a dental checkup, maybe like a routine cleaning and giving some advices to oral health. But when you come for the first time, it's like, okay, we will give you some antibiotics and then you will come for surgery. It's like, oh no, what am I getting myself into it?
Yeah. And why do you think that is, in terms of like, because obviously these patients, right?
Yeah.
They're suffering quite a bit, right? And maybe in
Yeah.
the beginning, fine, and it's like sort of like they can get by with it, but it's at least personally, if I knew something was not right, then the sooner than even just for peace of mind,
Yeah.
right? You don't want to think of like, oh, the worst case scenario kind of thing, right? So is that like is it some, I think probably a lot, it's not just Kosovo, there's other countries where
Yeah,
people
yeah, yeah.
just, they'll wait, and it could be for a number of reasons why they don't go, because maybe, for example, in the UK, I do remember like people avoid it until they really have to, because they also fear that it's such a financial burden, actually. So, and that's maybe for certain, again,
But I don't think that's like the first thing that you mentioned, because you have also the university that you can go for free. It has to do with the misconception that when you go to the dentist you will have pain. I think that's the first one. The second one, which is really important, I think has to do with the education of people.
okay.
I think that oral health should be more included on schools,
Yeah.
and to educate students that they have to do routine checkups, not only for oral health, but health in general.
Yeah.
Because especially in Kosovo speaking, they never do lab work, only if they have like a disease, worst case scenario.
Right.
And then they're lazy also.
Okay. Is it like in the sense that, it's going to take me too much time to go for this
Yeah,
checkup?
yeah. I better go and have a coffee or a beer instead of going at the dentist and see those instruments and that noise and that smell that nobody loves.
Yeah, for me, I think the drilling. The drilling.
Yeah,
like,
I know that's the worst.
And it's sort of, even when it's sort of like the kind of cleaning that.
Yeah,
that
I know that sound.
And it's like, it gives me goosebumps.
I know.
Like every time. Like
You never told me that. Next time, get your AirPods and listen to music or your podcast.
Oh, really?
Yeah.
But isn't that kind of rude?
No.
Like, shouldn't I
No.
be paying attention to what's going on?
No.
Because that, and then, but then also, like, if I'm, for example, waiting in the by the reception, right? Let's say,
Yeah.
right, and you hear that sound, right?
Yeah.
It's, even if you know that's not going to be applied to you, it is quite a daunting experience, especially, like, for example, a young kid,
Yeah,
right? The first time you go,
yeah.
right, and you hear that kind of, and then, yeah, I think the other thing that I forget, like, a lot of the dental clinics that I think visiting growing up, they always played like classical music.
Oh, that's
And I think
cringy.
there's a bit
I know.
and it's nothing wrong, I guess, but then it just adds to
It
maybe
makes
the
more
stereotype,
dramatic.
you know?
Yeah, yeah.
But okay. So when you then decided to like become a dentist or like dive into like the world of oral health, and you went, so you started initially at University of Pristina.
Yeah, yeah.
And then you're currently working on your PhD to
Yeah.
Zagreb.
Yeah.
Like, sort of, what was that? Is, if you could maybe just educate me and also the audience in terms of like University of Zagreb. Yes, it's renowned, but is that also like very reputable for dentistry?
Yeah, yeah. It's
Okay.
in like the top 400 universities, and it's one of the oldest university on Europe.
Okay. And then in with regards to dentistry as well, that's
Yeah, 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 yeah.
Okay.
Yeah, yeah.
And when you're doing your PhD, like in terms of like the specialization, is there certain areas of focus that you were working
Yeah.
on?
My current focus is oral surgery.
Okay.
That's where my research is leading on.
Okay.
So
And when so that is anything within the mouth, is it essentially?
yeah,
or-
yeah. It has to do on the oral surgery field. It has to do with clinical stuff that will include patients and some results that I will take from the clinic at the University of Pristina and compare some results with the clinic at the University of Zagreb.
Okay.
But it's not done yet, so I will not give more like information until the paper.
Top secret.
Yeah.
All right.
Top secret stuff, dentistry stuff,
Yeah, I mean that sounds all exciting. Like, and
really boring stuff.
is it?
Well, for listeners, I guess, yeah.
Okay. Well, and then going like pivoting towards like, I guess you brought up like a really interesting point of like kind of the level of maybe awareness, right, of the general public of like the importance of oral health. And I think not only here, but sometimes when we think about oral health, it's more, well, it's not even health, I guess. It may be a little bit more on the mental side where we like there's an emphasis on the aesthetics, right? How clean are your teeth? Like how white, how shiny, like, you know, whether it's pearly white, these kind of things, right? Which I know that's also part of what you do at the clinic. But then in terms of like, you know, we had a brief chat around like the implications of oral health being sort of with, I guess, overall health, right? People probably kind of, maybe they're aware, maybe they're not. Probably they just maybe brush
Probably
it
not.
over. Yeah.
Most of them know.
So probably what would be like something that people ought to know? I mean, there's probably a lot of things, but in terms of the importance of oral health, right?
So the mainstream is that the oral health is not connected to overall health, and that is not true.
So that's the general perception. You're
Yeah,
saying.
that's the general perception.
Okay.
Like, oh, the heart, the lungs, they are really important stuff in our body, but when it comes to our mouth, aesthetic part is important, but as to bacteria and inflammations and cavities, no. They're not important as long as you don't see them.
Yeah.
You know, and that's really a problem because oral health is really important, and teeth are an organ and they are connected to our body, and the oral cavity has a lot of nerves and blood supply, arteries and veins is one of the parts of the body where the most bloodstream is. So bacteria that are hidden in our teeth are soft tissues, and they cause inflammation and infection through the bloodstream can enter especially the cardiovascular system and cause severe problems. I can give you an example. We have patients, me and Dr. Viosa, that are going to have like a surgery, especially a heart surgery. And the surgeon contacts us and says, you need to do the cleaning, the professional cleaning of the tooth, extract all the teeth that need to be extracted that are damaged, fix the teeth that have decay on, and do the endodontic treatments before the patient enters the surgical procedure. Because bacteria in our mouth are usually a focal point that can cause infections and problems later on, especially if you have like a stress or on your body, physical or mental. Also, like if you have a weak immune system,
Yeah.
the bacteria will cause an infection that will implement throughout the body and cause problems. And that's something that people don't know. For example, not only cardiovascular system, we have also diabetes and then infections of the lung and overall the systematic parts of our body. And so also one thing that is important, periodontitis, for example.
Yes, gum health, right?
Yeah, gum. Periodontitis is an infection of the gum that can, firstly, it starts as an inflammation and can cause problems on the soft tissues around the tooth, and it can cause like the tooth damage. So periodontitis is really related with cardiovascular system. It can cause really severe problems.
And people probably also correct. Well, obviously, please do correct me because there's a lot of occasionally there's some half truths that come out, especially for me on this show. And but isn't periodontitis like once it starts, there's no reversing?
Well,
or like you can kind of you can manage it.
You can maintain it.
Okay.
If you do.
Like it'll never go away, right?
No.
Yeah.
But you can maintain it throughout dental checkups and professional cleanings and scalings.
Yeah.
And knowing the right technique to clean your mouth and brush your teeth, and floss. But yeah, it doesn't go away.
And that's
it's
something
irreversible.
And that's something that people probably aren't aware of either, right? Like
no. And that's one of the main causes that people lose their teeth.
Because it's advanced so far that the gums become too loose to hold
the bone.
Okay.
The bone is lost, and then the teeth will start falling.
Wow.
So,
okay.
Yeah.
That's like a bit of a nightmare, isn't it?
Yeah, it is.
And have I'm sure. I guess you witnessed those kind of cases as well.
Yeah,
right?
of course, and it's like also it's a problem for your mental health, because people like having like aesthetically good smile.
Yeah.
And it becomes something mentally not good for them, of course. And you cannot eat the right food, and then you will have malnutrition, and you won't be able to smile like you used to, and the function of your healthy teeth, no teeth will replace. No implant, no nothing. So
the implications are quite severe, and it's something that I guess we tend to focus on the superficial side of things, but actually
definitely yes.
It's actually it's one of the basic things that we really need to maintain, right?
Yeah, definitely. I have like a lot of examples, especially girls, because aesthetic now is a trend, and they come for like lip filler or Botox or teeth whitening, and then I'm like, okay, I will firstly do like a dental checkup.
Yeah.
And I'm like, you cannot do lip filler or teeth whitening because you have other problems. You have like cavities, you have gum infection, things that you need to cure before you go into aesthetic.
And sorry, like why is there like a kind of a medical explanation as well? Certainly like you need to take care of these because if you don't, they advance, right?
Yeah.
But is there also something that prevents the aesthetic procedures, like by having like the periodontitis or cavities or something like that? Like what?
Yeah. First is education.
Okay.
Knowing the right technique on cleaning your teeth, flossing regularly, doing dental checkups and professional cleanings, eating the right food, the least amount of sugar, at least eat the healthy sugar of the fruits, not the processed sugars.
But would you like? I guess first and foremost, you want to have like healthy oral, you want to have the patients or the clients the best oral care, right? But like if they insist, like, oh, don't worry, like Dr. Adea, like just give me my fillers. Like, I mean, it's not ideal, but is that something that you would really insist that like they get their teeth kind of taken care of, or what needs to be done first before kind of recommending those procedures?
Yeah, I definitely do my part by advising them and advocating on oral health and oral in general.
Because some people could be very ignorant, right? And just like, hey, I don't listen.
Yeah, I don't care, or she just wants to take my money and. Because there are people who think like that also. But I won't do damage. Like, I will give my advice, and then it's your job or it's your body. So right? Your responsibility. So you decide for your health. I'm just here to educate you and take care if you would let me, of course. And then it's in your hand.
You brought up certainly like the types of foods, right? So nutrition, like certainly like, if you're eating very processed sugary foods, like that will lead to, let's say, a more accelerated decay
cavities, decays.
And also certain foods probably like inflame a little bit more the gums as well, right?
Especially food that have a lower pH. That ruins the balance of your mouth and saliva in general. Like acidity food. Soda.
Soda, okay. Are there other, like, let's say, Albanian dishes, for example, that people love to eat here?
Turshi. Do you know what turshi is?
Maybe. I don't know.
Pickled food. I mean, pickled veggies. That has a lower pH.
Okay, so those as well.
Yeah, that causes the abrasion on your enamel.
Okay.
We drink a lot of coffee. That's also not good. Then, do you know the Russian tea?
Yes.
We drink it a lot.
And that
causes a lot of pigmentation on the teeth.
As does coffee,
That's
right?
why Albanians don't have like beautiful pearly white teeth, because we drink a lot of coffee and Russian tea.
What about...
And soda.
Okay.
Soda is really bad.
And then also a lot of people smoke here.
Oh, yeah. Yeah, I forgot that. That's the worst. That's top notch, the worst.
That you could do for your teeth, gums...
For everything, your heart, your lungs, your...
Sure, yes. But is it in terms of like oral health? Like, okay.
That's the worst. That causes like oxidative stress. And that causes so much problems, especially like if you have like a wound on your mouth.
Okay.
Healthy people, it will close.
Yeah.
A lot faster and heal. But comparing to my patients who smoke, it takes like forever for something to heal.
Okay.
And also periodontitis.
Yeah.
And tooth staining. So smoking is really, really bad. It causes oxidative stress on your mouth. Okay,
so then when you combine these different things, then it's almost like it could create like already a really bad situation.
Unrepairable stuff.
Okay.
Unrepairable health problems.
And I guess is going back to sort of that educational piece, like, is it just because growing up people are not told, or is it almost like because you grow up, people, you're taught that you have to brush your teeth, right? And we don't like it as kids, right? But then we
don't lead by example. I think it's also the parents have a huge role. If children don't see their parents have a healthy living, healthy lifestyle, brushing their teeth, not smoking, eating healthy food, serving their children healthy food on the table. I mean, who are we?
To
learn better. And even when we learn better, it's too late. because we're at that age when some damage is done and it's unrepairable. Coming from my experience also, because
Yeah, like,
as a child, I used to eat a lot of sugar, and I did not brush my teeth on the right way until I got on med school and learned the right technique.
okay.
So
And then the rest is history.
yeah.
Now your teeth are impeccable.
yeah, yeah.
Okay. Well, I guess
mean,
especially
at
like
least
you have to.
I'm trying to.
Yeah, because I mean, I think it's if your dentist didn't have nice teeth, then you'd have probably second thoughts. Just like if you go to a doctor and the doctor's maybe not the healthiest looking person, then
Yeah, I know.
maybe you also kind of will have doubts as also if you are looking for a trainer and the trainer is clearly not in shape.
He's smoking. He's
Then-
training you and smoking. Or if you come and do like a dental checkup at my clinic and I smell like Marlboro or something.
Yeah. Then it's also.
Of course,
what
you
kind
won't
of-
take the advice serious then.
Yeah, it's there. The credibility is kind of maybe a bit questionable, right?
Yeah,
So-
definitely.
Regarding then sort of like training as well as because I know you're also an avid trainer. You like to
Yeah.
you enjoy outdoor sports as
Yeah.
well. Now, when it comes to like oral health and fitness, like there's also quite a bit of there's certainly crossroads, right? Where I
Yes.
know, I think like in certain professional like athletes when they get checked by their teams, like they certainly will, like there's a deep dive kind of check in terms of their oral history as well,
Yeah.
right?
Yeah.
Is there stuff around there that maybe that's come up that you could maybe share with us?
Yeah, yeah. I've seen some published papers, like research that dentists have done or scientists, when they show the relationship between oral health and athletes and their performance. So it definitely has like a relationship between oral health and gym and exercise and the health of the muscles and the body. I saw some researches where they did on elite athletes actually.
Yeah.
And people who had like poor oral hygiene,
Right.
they could not perform right. Their
Okay.
stamina was low and their performance was low also. Like severe problems like periodontitis, malocclusion, especially people who had pain, like tooth pain or inflammation on the jaws and the gums, their performance was not right. Also, there was another connection between teeth pain and malocclusion and
Sorry, I'm going to
Yeah.
interrupt you. In terms of malocclusion, for those that are not entirely sure what it is, if you don't mind, maybe just kind of to.
yeah. I'm gonna say this like in black and white so people can understand better.
Sure.
When you cannot bite right, there's like a problem with your biting,
Oh, okay.
and there can be
Where it's, like,
different
uneven,
factors.
Kind of. Almost. Is that
Yeah,
one type?
it can be one type when
Okay.
you have like an uneven biting,
Yeah.
or you have some problems with your jaw, or you cannot bite because you have pain on the tooth.
Right. Okay.
So these are some kind of factors.
Examples of-
Yeah, examples.
Okay.
And people who have those problems will not eat right, and they will have like a malnutrition. And the dietary part also
Then-
impacts the athletes.
Yeah.
So everything is like related.
Yeah.
And also, like, if you have a poor hygiene and you wake up in the morning and you go at the gym, you will have fatigue because of the bad breath. And I've noticed, like, when I train with my friends and they're like, even though they have condition and they're like, they have strength and they can exercise, they're like, no, I don't want to exercise anymore because I need to puke.
Okay.
And if it's not something related with the digestive system and the conditioning of your body, it definitely has to do something with your oral health.
Okay.
So you need to check that up.
Yeah. Okay. Now, in terms of sort of like, I guess if with the examples like periodontitis, like when there's like, it's like a bit of a tongue twister. When there's like constant inflammation, then I guess it probably makes sense that then the athlete is susceptible, like it's like
Yeah.
where then they're dealing with inflammation elsewhere, almost, right?
Yeah, because especially if you have like a chronic periodontitis,
Yeah.
it will cause like an immune response throughout the body. So it will affect the muscles and the conditioning of the heart and everything. So you will be more tired, you will have less strength, and you won't be able to perform and exercise like a healthy living person does. So it's almost like a chain reaction. Everything is related.
Yeah. And do you feel, now this might be sort of out of your scope as well, but or it might be out of your scope or not, when it comes to sort of professional athletes, maybe some of your clients are also professional
Yeah.
athletes as well. What is that something that, like at a team level, that there is also kind of checkups like instilled, or is it very much each athlete is just kind of trying to do it themselves?
Well, I think it's pushed, I think, from the team or the
Okay.
coordinator,
Yeah.
because they do regular lab checkup, they
Okay.
do regular dental checkup. It's like something that they have to do consistently, so they have like a good health and they can perform right. So, I mean, I think it's something that it's stuck with them from someone else, especially here.
So you'd say like athletes or sports, people heavily involved in sports tend to maybe have better oral health?
Yeah.
Okay.
And it has to do with the consistency that they have and the education, and like they are really consistent. They want to be healthy in terms of eating good, hydrating themselves, going at the doctor to see if everything is well, so it won't like make problems when they have a performance or they exercise.
I guess that makes sense, because it's like fitness is super important. I mean, this show, you know, we explore different topics around health, fitness, and lifestyle. But then,
Yeah.
without health, the fitness is hard to maintain, right? So
Definitely.
it's certainly like it's a precursor.
Yeah.
It's like it's a must, right? And if you're performing, if that's how you're providing and making money, and kind of that's your career, then of course you need to really be on top of your health as well, right?
Definitely. Even like if you're not breathing the right way, you won't be able to exercise the right way, and you will have oral problems also.
Is that, so? Because breathing is something that's come up on a number of episodes, and so and it's something that I definitely want to explore a little bit more. But from your practice already, like, do you, like, is it apparent if someone is like nasal breathing or mouth breathing?
Yeah.
What kind of, and now, so of course,
And there's also the combined nasal and mouth breathing. So
Okay.
there are 3 types of breathing.
and then so in terms of especially mouth breathing alone is the worst,
Is
right?
the worst. Especially, I mean, I think in your type of profession, when you do aerobic exercise, I think that's pretty bad, coming from my experience too.
I think it's something I think that people will do, especially if they're under stress, in the sense that it's very demanding, right?
Yeah.
But if they can kind of nasal breathe at the same time, then sure, I think there is a lot of benefit to that. I don't think it's the end of the world if they're mouth breathing,
Okay.
because it just it could also be the level of fatigue, right?
Yeah.
But if someone, I think, is already just accustomed to mouth breathing all the time, then I think then that's where it becomes a bit more problematic,
Yeah.
right? But like, I guess when it comes to the oral health, or like the tooth, the state of like the teeth, like when someone is like mouth breathing, do you like it? Is it apparent to you, like when you
Yeah.
see?
It's the first thing I've noticed. I
Oh,
noticed
really?
in
Okay.
a patient. Yeah.
What kind of things like become? What could you share in terms of when obviously, like, the patient comes, they open the mouth, and then like, is it something so immediate that you're like, oh, do you mouth breathe?
Yes.
Okay.
Yes. Do you know the small mirror that I check the teeth with?
Yes, the one that you hold.
Yeah.
Yeah. Like almost like a magnifying.
Yeah,
Yes.
that. People who breathe with their mouth, I won't see on the mirror because it will be all.
Oh yeah, right. Because they're breathing out
Yeah,
in and out, so
in
it
and
just
out.
fogs up.
It
Yeah,
fogs up and it's annoying. That's
Yeah.
the first thing.
Uh-huh.
The second thing, when I start drilling or using the water, they will need to spit because they cannot breathe.
Okay,
And
yeah.
that's the problem, because they cannot keep their throat open and breathe with their nose. So
Okay.
that's also
So it
annoying.
almost like prevents you from doing like it.
From doing my job.
Yeah.
And especially if it's something that the bacteria should not enter the mouth, especially during a root canal treatment. They should keep the mouth open wide, and when they need to spit, the bacteria from the saliva will enter the root. So there's a lot of problems with breathing in dental work too.
Okay. And that it is in terms of like sort of like you would obviously then advise them like, hey, you need to practice nasal breathing.
Practice nasal breathing. Do like a checkup. Why are you breathing with your mouth? Maybe you have like some sort of problems.
Yeah.
Yeah.
And like people, I guess a lot of probably patients are just unaware of that too, right?
Yeah.
Yeah, okay. So, okay, then those, I sensed a little bit of frustration of like people that breathe it with their mouths. So so if anyone is visiting Identity Clinic, make sure you
don't breathe with your
mouth. Make sure you're breathing with your nose, like, because she might get upset.
Practice stomach breathing or diaphragm breathing before coming. That's good for mental health also.
Yes, no, absolutely. No, breathing is super important, and I think it's also one of those things that gets overlooked where people like take it for granted because it's like, well, I know how to breathe, right? Like but yeah, I guess so then that's something that becomes quite apparent when especially you see a new patient.
Yes, the first time they open their mouth, that's the first thing I notice. That's the first thing that comes. And mouth breathing is not good also for your health because, the nose, it extracts a lot of particles.
And toxins from
and
the
toxins,
air, right?
yeah.
Yeah.
It's like a cleaning airway. So when it enters the mouth, it's not good.
And I guess the whole olfactory, like that like the nose and everything, like that's also something that you guys probably like check upon, right? When someone is like there just to get maybe a cavity fixed, right? That's
when you come for a dental checkup, there's a lot of things that we notice, and that like we say, okay, your breathing is not fine, you should go and visit like a ORL or something like that is called in English, otorhinolaryngolog.
Okay, yeah.
Yeah.
And I think I know what you mean. I don't know what the exact term is.
And we advise to go on different specialists, medical specialists, and to visit for the current problem that we notice. So it's like a general checkup, not just a oral health checkup kind of thing.
Right. No, it's I think like one of those things that people it's funny how they take it for granted almost, right?
Yeah.
And then also probably at times just ignorant as well, right?
Yeah.
Because it's sort of like, okay, if it doesn't hurt, why should I even bother, kind of thing, right?
Of course. And also information is key. I mean, even coming from my perspective and my experience, even when I met you, we shared different informations like, okay, I'm a dentist, I have a back problem, what kind of stretches should I do for my profession, and what kind of exercises. And then I noticed that you had like a gum recession, and the neck of your tooth was discovered, and I was like, hey Q, you're not brushing well, you should use this kind of brush and this kind of technique.
Every time still learning.
Well,
yeah, but no, of course,
I know my patient when I see, and I know like the consistency, and I know the way that he or she brushes his teeth, and
these things, like because you have years of experience, and like you see these signs, right? So,
and in the end, it's giving information to my patients and making sure that they get the best out of me and my education and my experience, and maybe I can learn something from them too, like I learned from you.
So, well, if there's anything I don't know. I think there's probably not much I can really provide or teach you. But
you're being like, I mean, you're being I did learn a lot. You're being modest.
Perhaps.
The
Perhaps.
word I was
I
gonna
think
use.
you're being very kind. In terms of then, like, going back to, like, so your patients, what would be, because it'd be probably interesting, like, it might sound so obvious, but again, like, classic example where, you know, I come in even regularly and it's still like, all right, this is how you got to brush your teeth to
Yeah.
avoid certain XYZ, whatever it might be, right? Like, what are the, like, let's say top three, if you can, kind of things that you notice that
Yeah.
people need to be doing that they might not be doing?
Okay. So first of all, I'm gonna make like a comparison between gym and going at the dentist.
Okay.
Probably you had the same experience, like people coming at you and being like, "Hey Q, I'm working out, but I'm not seeing results." And you're like, "Okay, but are you eating well? Are you getting enough sleep? Are you lifting weight the right way, the right technique?" Because those are things that you gotta check up.
Yeah, it's like nothing is in isolation,
Yeah.
right? Yeah.
So it's the same with the oral health. Like people are coming at me and they're like, "Oh, but I come for a dental checkup. I brush my teeth twice a day and I don't smoke and I eat well. Why do I have like dental plaque? Or my breathing is not good." And I'm like, "Okay, what kind of brush do you use? How do you brush your teeth? Do you floss?" These kind of thing matters.
Sure.
I mean, it's not only you're brushing your teeth and, okay, I'm healthy now. You should know the right technique. You should brush twice a day, daily, in the morning and before you go to bed. And
Okay.
you should not eat after you brush your teeth when you go to bed. That's forbidden.
Sure. And,
Sure.
Like, but no.
No.
And like that's
That's
for me,
really important.
Once I brush my teeth, like that's it, you know, for sure.
I-
But is like it sounds so obvious, but is it
But
kind of
they don't do it because we all have it. Like we brush our teeth, we go to bed, and they're like, "Okay, I need a snack. I will snack a little," but I'm
and
too
then they don't
lazy
just
to.
brush my teeth?
Yeah,
after.
again, yeah. And then there are certain areas on the teeth that the brush cannot reach. That's where the floss comes in. Flossing throughout the day, especially after you eat, is super important.
After each meal, would you say?
Yeah. After every meal. Q.
You heard it first here, guys.
Yeah.
Okay. After every
And-
meal, I only floss like once.
No, you should floss after every meal because food is stuck between your teeth and it will cause decay. And those parts of the tooth will not be reached by your brush.
Okay.
And also some things that's really trendy, but I think it's overrated, are smoothies.
Okay.
I
all
think
right,
you
I
notice
like-
those
okay.
smoothies at the gym, Q.
Yeah. Oh, like protein shakes and stuff?
I mean, fruit shakes, probably. Why do you need to smoothie like apple and banana? You can eat it. It's good for your oral health. It's like it will wash out the bad bacteria when you eat an apple. You don't smooth it out. It's good to cause friction on your tooth because like you have muscles that you train, your jaw has muscles also. And when you eat an apple, you strengthen the muscles of your face.
Yes. Oh, okay. Yes. So
This is another topic now.
absolutely. Yeah. No. This is great because there is an aspect of what you don't use, you lose, right?
Yeah.
And so yes, the jaw muscles. Like, I mean, I think there's a lot of muscles that like
Yeah,
are
a face has like a ton of muscles that we don't know. Like we don't make it like apparent.
and then also in terms of like your actual teeth, right?
Yeah.
There's a certain amount of feedback that's needed, right? Through the
Yeah.
crunching of especially harder foods.
Of course,
right?
it's like a muscle. You should use it. You should strengthen it. It has ligaments just like the muscles, and they need to be used. That's why they are made for.
Okay. And do you feel that so if someone is, you know, having smoothies all the time, like
Yeah.
I think sure, like if they prefer like, you know, it's not the end of the world, but
Yeah,
then it's
yeah,
more
yeah.
like, hey, you need to be eating like whole food or real foods
Yes,
as well. Like
raw foods. Let's just say.
so is like, is that something also that you can tell, like when you see someone's teeth, like, oh, like you're eating
Yeah.
just soft foods all the
Yeah,
time?
it has people that eat soft food have more dental plaque.
Oh, okay.
Yeah, they need more cleaning, professional cleaning. They have a lot of like on their tongue. They have a lot of like yes consistency
Okay.
from the soft food, and that causes the bad breath.
Okay. And then
But that is
yeah.
long-term effect. I mean, if you use it consistently, not like if you use it once or
Yeah,
twice.
like, oh, it's like, oh, okay, for the last 6 months all you
Yeah.
had was smoothies, then
Yeah.
it's going to be pretty apparent. Okay.
Definitely.
What is then, I know, like, for example, on my Instagram feed, for example, quite often, and I don't know, like, if it's more the US or well, especially US, UK, I feel like, and maybe certain other countries in Europe, where these cubes that you put in your mouth to chew to train your jaw have become
Okay.
quite popular. Are you familiar with any of these?
Well, yeah, I saw them, but I don't think they're popular here in Kosovo. But I saw some instruments that they use, especially for their double chin and stuff like that.
Okay. Like I feel like I've read like mixed reviews. I don't know if you have an opinion on these jaw exercisers or whatever, and it's basically like, I don't know, it's like probably like this size kind of cube, and people are like chewing on it, and there's different like strengths almost of it. Is that something that, like, what are your thoughts on it, or is it just like, hey, just eat regular food and that should be fine?
Well, I always prefer the natural way.
Okay.
Like, go and eat raw vegetables and fruits and meat and chew gum throughout the day, sugar-free gums, and you will be fine.
Are there, like, in terms of like the hardness of certain foods, because like also like, we're talking about like, okay, moving away from just soft foods, you need to
Yeah.
eat, like you mentioned apple, right? Like,
Yeah.
or are there other foods that you would recommend that like someone ought to eat once in a while just to be able to train the teeth, the muscles, and these kind of things?
Carrots.
Carrots? Is that okay?
I mean, like vegetables and fruits in general is not something quite on particular.
Yeah.
Also nuts.
Okay.
They are important for your health.
Mm.
And they are quite strong and something that you can chew on. And then meat and things like this, natural stuff that
Yeah.
your body overall, your health needs.
Yeah.
Yeah.
But I mean, that's also something that people forget about, like, in terms of like, okay, like it is something that you need to, like, that
Yeah.
consistency of,
These are like simple things that we are tending to forget. Like, yeah, you should go a little bit retrospective, because we are getting so used to these new trends that are good and are making our life easier. But
like these quick fixes, right?
Yeah.
We're always looking for.
Yeah.
And at the end of the day, it's like, hey, like, okay, so it's brushing your teeth like twice a day. Like, after you brush it in the evening, stop eating.
Yeah.
And
Flossing.
I guess flossing for after each meal.
Yeah.
And then also eating.
Avoid refined sugar
Mm-hmm.
and chocolate and fabricated food in general. And
Are there, so this also just another question popped up in terms of toothpaste,
yeah.
right? Like toothpaste, that section in the
Oh
supermarket.
my God, the most used question in my clinic, toothpaste.
Yeah, because, and then again, it's probably like, what is the best one, right? Because what prevents me from having to come like here again, kind of thing, right? But then when you look at the toothpaste, I think for most people it's pretty confusing, right?
Yeah.
Because it's like whitening to 24-hour, 40, these icons and whatever, fluoride and all this, and then you
Yeah.
have like also like certain like
Organic.
organic
Yeah.
and. So is there like some BS to some of that stuff?
Yeah.
Like in terms of it's just marketing, it doesn't work?
Yeah.
Because like I think I'm still fairly uneducated around oral health, like in the past, I've definitely bought like, Colgate, whatever, or any brand whitening, and teeth doesn't get any whiter, than like I've used the
Without
whole
using
box.
some
Yeah.
chemicals in there. Hey, that's all marketing.
So those whitening,
You need the chemicals to whiten the teeth.
yeah. So is that like basically not real?
Yeah.
Okay.
In some sort of level, yeah. I mean, it's quite a marketing. I've been using like a simple brush and toothpaste my entire life, and I never had a whitening session.
Okay.
What do you think?
Yeah, I mean it's
As a public,
yeah, no, it's as white as it gets. Like you are,
I've learned in.
a beacon of oral health for sure.
Thank you. I've learned from my school that the paste, it's not important.
Okay.
It's important.
I mean, you still need something, right?
Yeah, of course you need, especially when you're growing up, you need a little bit of fluoride on that paste so it can strengthen the teeth.
Okay.
But it doesn't have to be like a bougie toothpaste. You can use like a simple toothpaste. I don't recommend whitening toothpaste because it damages the enamel that's unrepairable.
Okay.
The surface of the teeth is damaged
Yeah.
with whitening toothpaste. Plus, it doesn't do the job quite good.
Okay.
So you can use a simple toothpaste,
Yeah.
for my opinion. If you have like periodontitis or you have sensitive gum, use toothpaste that is made for sensitive gums,
Okay.
like Sensodyne.
Okay.
And you don't need anything bougie.
Right.
It just has to do the job to remove the plaque
Yeah.
and to remove the food, and that's it.
And then
And fresh smell, of course.
Sure. And then you also mentioned, so that leads me to two more questions. Sorry.
Okay,
And
no problem.
And this like for the public.
It's
so,
a chain.
Yes. So, type of toothbrush, right? You have soft, medium, hard for
Hard.
in terms of like that. Like, how does one know? Because me personally, and I think you've asked me like a number of times because of like
Yes.
maybe the receding gums and these kind of
Yes.
things. Like, I know soft. Like personally, like it just doesn't feel good.
I know.
Right. And then hard, like I guess like there's a bit more feedback and probably you feel
Yes.
like it's getting cleaner, but maybe it's actually too much, right?
Yeah.
So is that like by default almost most people should go for medium kind of strength toothbrush? Or?
Usually I prefer the medium brush
Okay.
for the most common people. I mean, for the most common number of people.
Yeah.
People who have like sensitive gums, it's preferred to use the
Soft one.
soft one.
Just to be careful, kind
to
of.
be careful, and also the children.
Right.
And then people who say that they smoke a lot, have a lot of coffee and tea, and they have a lot of pigmentation, they can go for the hard one. But they have to be careful with their gums and their
Because their gums are already irritated
Yeah,
from what
from-
their activities, right?
from the oxidative stress that comes from the smoking.
Okay.
But at least they should be careful with their brushing technique.
Okay.
If they know the brushing technique, they should be fine.
And if they don't know, go see
Yeah, definitely.
And then in terms of like mouthwash.
Yes, coming to that. But before,
Oh, sorry.
don't be afraid to ask your dentist what kind of brush and toothbrush to use, because it's sometimes is individual. And the dentist has to see.
It's not a one size fits all, right?
Yeah, definitely.
Are people like? Do you think people are embarrassed to ask that?
Yeah,
Really?
because it's like a mainstream question that everybody should know. Is
Yeah,
that
but it also
misconception?
probably changes over time, right? Depending on your oral health, right? Like you could start off with a hard toothbrush, and then like maybe you would advise you should
but
probably change it, right?
People like they will feel judged, like, oh, I'm not brushing right.
But-
They will
but-
think
but-
that I don't
but
brush
the-
right.
But the teeth don't lie, right?
Yeah.
Like
but,
you see what you see, and it's
yeah,
like
but people don't know that.
yeah. I mean, I guess we all have like when we see a dentist, we open our mouth and there's nothing we can do, right?
Yeah.
So
And coming to the
mouthwash.
mouthwash.
Yes.
You mean the chemicals that are used to wash the mouth?
So I don't
Like
know,
the rinsing?
yeah, like I don't know if where, but like again, this is something I haven't really like looked into, but in much detail. But like, is mouthwash actually beneficial, or
No.
like
Straightforward.
no,
No.
that's what I thought. Like
Water. Water is the best.
okay. What why?
Hydrating wise, rinsing your mouth wise, and for everything.
So once you've brushed your teeth, then like all you need to do is just rinse it with water.
Yeah, that's it.
Okay.
Because mouthwashes are chemicals. They are fabricated. And they will take out the good bacteria from your mouth. And they will disbalance, because mouth has good bacteria and bad bacteria. So once you kill the good bacterias, you will disbalance the flora and the biosystem of your mouth.
And like, so like the Listerines and all this, like it
Yeah,
just destroys it.
Yeah, it destroys it.
Okay.
And mouthwash should be only used when it's prescribed by your dentist.
Okay,
like
so
if
there
you
are
have,
instances where
yeah,
you would,
like
yeah.
when you have like gum inflammation,
Okay.
or bleeding or an infection.
Then there are
Then only subscribed by your dentist, because mouthwashes can be as strong as antibiotics, and you
Okay.
should not be used on a daily basis.
Ooh, all right. Okay, but it's again something that people feel like, as when they go to like find their, in that aisle where there's the toothpaste, the toothbrushes, and mouthwashes,
Yeah.
like
Don't overdo it, people. Overdoing is not good also.
because it's one of those. It's almost like a reflex, right? People probably
Yeah.
just buy it thinking it's good, right?
Yeah.
Okay.
But bacteria live with us, and some bacteria are good.
Right.
Like, you should not use alcohol nonstop on your skin, because
Yes.
it ruins the barrier of your skin. It's the same with the barrier of your mucosa, of your saliva.
And that's
So-
even probably more sensitive, right?
Yeah, definitely.
So
Yeah.
okay. That no, super helpful. Like even just for myself, like I don't use mouthwash for.
No.
It's been a while, but there was a time where I was just ignorant and thought it was.
You can
something-
use it when you go on a date. I will forgive that. Or if you're traveling by plane and you need, like, you cannot brush your teeth, and you just use it
Yeah.
to be like,
So
more
like once in a
flexible.
while, fine kind of
Yeah,
thing, right?
yeah.
Okay. Now, gonna pivot here again a little bit and slowly wrap this episode up. But in terms of sort of like you yourself, you obviously are working full time. You're also pursuing your PhD as well
Yeah.
as like trying to stay fit and healthy. Like, what are some things that you're working towards this year?
well, personally or professionally, or both?
Sure.
Well, personally, I'm trying to become healthier, because
Okay.
I have a habit of eating like sugary foods. So I want to
the
avoid
dentist,
that.
the
Yeah,
dentist eating
I know.
sugary foods.
I'm being sincere now, so don't judge. I want to work out more,
Okay.
because I've been working out for like 3 times a week.
Mm-hmm.
I want to take it to 4 to 5.
Okay.
So in general, just keep myself even more healthier and eat better. And professionally, I want to finish this PhD, and also follow some trainings so I can be better and give new experiences and stuff to my patient, and just keep up with the dental trends. And also follow a specialization on oral surgery and become an oral surgeon, I hope, in the
Okay.
near future. So these are my like small step-to-step plans. And yeah.
Amazing. All right. Well, Dr. Adea Karakashi, thank you so much for your time and educating myself and hopefully whoever's listening, in terms of what not to do, what to do. There was some, I think, really interesting, and it might sound obvious, but really helpful tips in terms of kind of maintaining oral health. And then I think one last thing would be like, as much as we might worry or think of the worst case scenario, like if there is something, like don't hesitate, go get your checkup
Yeah.
before it manifests into something maybe a bit more troublesome. So thank you so much, Adea.
Thank you.
And everyone tuning in, that was another episode of Never the Right Time. Thank you. This was Coach Q on Urban FM 105.5, 103.5 FM. Thanks, guys.